Good evening and welcome to RFL. I'm Richard French. We're going to start tonight with a COVID outbreak and some strong words coming from Dr. Anthony Fauci.
This is the worst outbreak that we've had of a respiratory-borne illness in 102 years. You can't run away from the data. It's incomprehensible to me how people are not seeing that. These are real numbers.
In a minute, some good news, believe it or not, when it comes to COVID. I'm talking about the race for a vaccine. But first, the numbers that Dr. Fauci is talking about. The virus, it has now killed 250,000 Americans. Get your arms around that. 250,000 of our fellow citizens gone, including more than 1,500 in just the past day. We have 11.5 million total cases, those cases soaring by more than 155,000 each and every day. More cases means more people in the hospital, 77,000 Americans now hospitalized fighting COVID. That is the highest number we have seen. But help could be on the way, that in the form of a vaccine. Pfizer says it is ready to apply to the FDA for emergency approval of its vaccine. That after the drug company announced its treatment was 95% effective in late-stage trials without side effects. Again, that's their reporting, but still. Earlier this week, Moderna said its testing of vaccine could also be close to 95% effective. So the race is on to get to market, but that will have huge logistical and manufacturing challenges. The first round of people, including healthcare workers, nursing home residents, they could start getting their shots possibly as early as next month. The CEO of Pfizer says their goal is to supply several 100 million doses by next May, so we could see a quote-unquote normal summer and winter. That is, if everything goes right and according to plan. He's optimistic. Let's hope that he's right here. But there is another obstacle. According to Joe Biden, that's the failure of the Trump administration to unbelievably just coordinate and cooperate with Biden's people.
Soon we're going to be behind by weeks or months being able to put together the whole initiative relating to the biggest promise we have with two drug companies coming along and finding 95% effectiveness, efficiency in the vaccines, which is an enormous promise. So I just want to tell you that's the only slowdown right now.
And again, I don't care who you voted for. We're going to have a new presidency. It's in America's best interest. It's in your family's best interest and mine that they work together here so the new administration's ready to be up and running by the latter part of January when they take over. But in the meantime, things, they are so bad. The outbreak is bringing seasoned health officials literally to tears, including the public health director in Illinois.
Since yesterday, we lost an additional 31 lives, for a total of 9,418 deaths. These are people who started with us in 2020 and won't be with us at the Thanksgiving table. Excuse me, please.
Illinois, one of many states that is closing things down in a desperate attempt to try to slow the spread. The governor has just imposed new limits when it comes to shops, sports, gatherings, plus the complete shutdowns when it comes to theaters, museums, and casinos. Now, other states, they're going even one step further in instituting curfews. Ohio, telling people to stay home between 10 p.m. and 5 a.m. unless they're going to work, getting food, or going to the hospital. Los Angeles, telling all non-essential retailers to close at 10 p.m., and that includes every bar and restaurant. Governor Cuomo in New York today announced that New York City schools are going totally online again. That as COVID cases rise as well. This spring, the virus was centered in New York, as we all remember, and a couple other places in this country. But unfortunately, it's no longer just a pocket here or there. Take a listen to this doctor in Oklahoma.
Everyone in the whole country is dealing with this, and we have no help. We have no support.
There's no cavalry to come because everyone's got their own problems. This nurse in Nebraska describes what her hospital is dealing with.
We have, I think they said 10 COVID units, and one of those is just a place for people to go and pass away, unfortunately.
Governor of Montana has this warning.
We need to turn things around over the next few months while we wait on a widely distributed vaccine, or else we risk hospitals that turn patients away.
Turn patients away. Now I'm going to wrap up by going to El Paso, Texas, and the horrors this nurse is dealing with.
The doors open and a bed, they coming in with a hospital bed. So I'm thinking they're bringing us another patient. Y'all, the morgue was so full of bodies that they had ran out of room. They come wheeling in a body already in a bag, lined them up with the rest of our alive patients.
Now we're going to continue to keep you posted on the outbreak. We're going to show you what is going on across the country as hospitals struggling to keep up with the surge in patients. And I should tell you that the surge is supposed to hit an apex at the beginning of the year, late December into January. We could be seeing literally 1 million cases every 3 days. We're at a record now with 155,000 a day. That's how the projection is shaping up, with super spreaders, seemingly perfect horizon here between Thanksgiving, obviously kids coming home from school, and you've got Christmas and everything at the end of the year as well. All right, joining us though to discuss the vaccine, which is the silver lining here, but also the challenges, how it will be distributed once it's ready, Lori Tremmel Freeman. She's the Chief Executive Officer at the National Association of County and City Health Officials. Lori, let me first start with the positive. If somebody said just a few months ago that, hey, we could be getting something in November, not one, but at least 2 vaccines, maybe with more to come, with a 90+ effectiveness rate, we would have signed up for that, 7 days a week and twice on Sunday. But we then get to the details of it, and they're big ones with logistics, as well as also, distribution. Overall, though, in terms of being comfortable that the public can take these vaccines, even though they've been rushed, do you share that comfort? We're dealing with the Modernas and the Pfizers right now, that right now we're comfortable with the quality of the product?
So yes, I think the public can be assured that these vaccinations, although they've been through a rapid process, have met the requirements necessary that the Food and Drug Administration have laid out. However, there's still an important step that has to occur once these vaccines are truly ready from the manufacturer. They have to apply for emergency use authorization from the FDA. And at that point, the FDA actually steps through all of the data and the science surrounding that vaccine development and the testing, and to ensure that they truly are ready for distribution to the public. And that step hasn't occurred yet.
Okay, Lori. So then we get to the hard part. I remember speaking to governors who, whether it was PPE or whether it was ventilators, the disconnect that was happening with the federal government and when you were getting to the state, let alone the local levels right now, that there wasn't a lot of direction as it relates to that. All right, let's say hypothetically that all the hopes we have are realized with Pfizer, Moderna, and even with, let's say, AstraZeneca and J&J, that it comes down the way we want. Are you comfortable that there is a coherent plan? And I guess this would go through the CDC in terms of, who's on first, who's getting which vaccine from which manufacturer. I understand they have different standards. Some have to be, kept in refrigeration at different temperatures than the others, geographically, by demographic. Is there any clarity how this is going to work?
Well, first of all, I think what you should know is that state and local health departments plan and exercise for mass vaccination immunization efforts as part of their preparedness planning and response efforts. And that planning, exercising goes on in preparation for the day coming when we have vaccines during pandemic that we have to distribute. And so lots of those plans, have been in place and exercised and are ready to go. They have to be informed by what is happening at the time, including the specific type of vaccine, the type of storage, how long it can remain viable outside of cold storage, and all of those details have to inform and evolve the plans. But I think that we are getting closer to readiness than many people may even imagine. It's really encouraging that the CDC is involved because they have they know how to do this. Our state and local health departments know how to do this.
So, Lori, you've got viewers watching us from all different parts of this country. So I'll do a hypothetical. If somebody's watching me and they are in Texas and in California, and then I got somebody watching me, let's say in New York and Virginia, is it going to work that, let's say, Moderna's going to get this part of the country, then you're going to get Pfizer that's going to get this part of the country? Not everybody, as I understand it, for example, can store, has these freezers that can store these vaccines that have to be taken in 2 doses at this period. So my point is, are they breaking out by geography? Is it the first one to produce it? They'll push it out. It almost doesn't matter who gets what. How do they distinguish with so many different manufacturers and different types of vaccines?
Well, all manufacturers of vaccine have already been contracted by the federal government. So there's not necessarily some priority system that exists between the vaccines. So when they become available, all resources will be brought to bear to utilize those vaccines across the country to make sure our entire country is protected.
And I don't want to put words in your mouth. You feel comfortable, and many people have, that we've made a major investment here in the production of this vaccine, and it's moved at really record speed, and it's very efficient to believe, at this level. If you have any concerns, it's that the investment to get it from the labs to the public, and given that we're about to hit a peak here, every estimation I'm hearing in January, we could be having literally 1 million cases every 3 days is some of the latest projections I'm getting. We don't have time to waste here, that once the vaccine's produced and then it's ready to be distributed, we have to have a much better plan, at least in place, an investment in place in terms of from lab to the public. Is that, if you had a concern, would that be what it would be?
Yes, there's no room for lack of coordination or collaboration here. This is all hands on deck to be sure that we do this efficiently, effectively, and that we protect people as soon as possible, especially those vulnerable populations. That's why we need the active engagement of our public health system, from the federal to the state to the local level, actively engaged in contributing to the best practices here. We need our public partners to be equally engaged in working with our public health partners to ensure that distribution occurs efficiently and effectively. But everything that I'm seeing and hearing right now is coming together, and of course there will be glitches, but hopefully we'll be able to account for those quickly and get those taken care of, and assure that there are plans in place to accommodate any possible scenario that might come up that may hinder us from doing this effectively, and get over that quickly so that we can continue to protect our citizens.
Lori, I'm not trying to drag you into the world of politics, but it's unavoidable here given that we're going to have a transition. Right now we heard the president-elect saying that if the incoming administration isn't briefed on this, and right now there's reports that folks at HHS are told not to cooperate in any way, shape, or form, he says lives could be lost, and people are watching us in New York right now. They've already heard that New York won't get the vaccine because whatever the beef is that the president has with the governor here. We don't have time for any of this nonsense, do we?
No, we don't. No, we don't. Front and center priority is protecting everybody in our country from getting this disease and in mitigating the further spread of it. Front and center, doesn't matter whether you're a Republican, whether you're a Democrat, whether you're independent. This is a health issue. It's a protection issue for our country. It's not politics. It's ensuring the health and well-being of our country. So this cannot be about politics. And I have not heard or seen anything that would indicate that Every state will be treated equally with regard to the distribution of this vaccination. It will be based on a pro rata population basis in terms of the allocation and the priority populations that will be defined once these vaccinations are formally approved and are distributed, is really governed by an independent advisory committee on immunization practices that takes into account a lot of different things, including the vulnerability of different groups and how much they need to be protected and how soon. That is not a red or blue issue. It's just about people and protecting them.
All right, I got to tell you, I feel a little bit more comfortable after hearing that this logistics and this distribution is going to be a lot more coordinated than maybe we've seen at different stages of this pandemic. So that gives me some hope here. Lori Freeman, I appreciate some time. So thank you so much.
My pleasure.
All right, everyone, when we come back, Senator Bob Menendez, New Jersey Democrat, he is the top Dem on the Foreign Affairs Committee. He's very concerned about how the president is handling his final weeks in office. He'll tell us why after this.